we've had quite a few questions lately about our therapeutics in Idaho, so I want to talk about those a little bit. And it's always hard to kind of talk about different drugs, and the names are challenging, so forth. So we put together a graphic for this as I'll be speaking. So there's one therapeutic, and you'll see that on the left-hand side of your screen there, that is for, it's not for treatment of sick people, but it's a really important product, and it's one of those that it really we're so happy to have. So this is Evusheld, and this is used for people who are at very high risk, and it prevents them from getting sick with COVID. And those of you that heard me talk about it before, I always use the analogy, because I think it's what most people are familiar with. I use the analogy of the hepatitis A, the immunoglobulin shots that people used to get, like a shot in the butt kind of thing before you went off to travel around the world. Now we have a vaccine, and people don't tend to get that anymore. But those immune globulin shots, this is the same idea. So what you're doing is you're giving yourself the antibody. It's what we call passive immunization. You don't stimulate your body to make your own antibodies. You're actually giving somebody antibodies. So this is a combination of two monoclonal antibodies that have been packaged together, and they've been altered in a slight way to make them last for a long time. And in fact, this drug has been shown to prevent symptomatic COVID disease for at least 6 months or longer. The studies they're still following people out, but this is an excellent protection. Because it is in short supply, this is being so this was just authorized December 8th. So again, as you'll see in below, and I'll talk about this in a second, we just have started rolling this out. This is all very new, but this has been prioritized for people with severe immune compromise, such as patients with cancer who are on chemotherapy, patients who have innate immune deficiencies, or who have had a organ transplant. And this has been shown to reduce the risk of infection, of symptomatic infection for these types of immune compromised people by 77%. So really an incredibly good thing for people who might not respond so well to the vaccine, or it can be used for people who cannot take the vaccine because they, for example, are severely allergic to one of the components, or just can't take the vaccine. But I just want to point out that, like everything else, so Evusheld is shown in green there. You can see that we get just very few of these allocated to us per week throughout the state. Somewhere between 100 to 300 courses are given to us, and we have been working with our cancer centers, and we have actually started to also reach out to providers that take care of patients who, for example, are on steroids or on immune suppressing medications, possibly for autoimmune diseases or other conditions. So we are trying to get these to severely immune compromised people. So that's one medication, and that's separate from the rest of the group that I'll talk about next, because that is all about treating people who are sick with COVID. And as you can see on the right side of the graphic, these are all medications used to treat people who are not in the hospital, who aren't sick enough to go in the hospital, but they are sick and they have high risk of severe disease. So for example, think people with underlying lung disease, people who have kidney disease, people who are 65 and older are in this group. Those folks qualify for the medications on the right. The one on the top, Sotrovimab, is also a monoclonal antibody, but it's not long acting. It's a short acting, meaning maybe up to 90 days it stays in the system. But this monoclonal antibody is an excellent choice for people who are already sick with COVID. And as you can see below, again, I'll kind of keep referring you back to that. You can see there, again, we have limited supplies. You see the low numbers that were being, I have the exact numbers later if somebody needs them. I'm happy to send those out. But you can see there just a few hundred doses per week. And then we had a gap where the feds actually held back on Sotrovimab because we had other monoclonal antibodies that worked for Delta, and they wanted to hang on to this. Now that we're in Omicron era, the other monoclonal antibodies are no longer authorized for use in the United States. We're not using them anymore, but Sotrovimab is effective against Omicron, and so we are continuing to use that. But you can see there that the supply has not increased. We continue to get small allocations every week. And that Sotrovimab, we are working with clinical providers throughout the state that can receive this directly. It is something that they need to be willing to do, and we make sure that we have a good geographic representation around the state for this one. That's how our main principle for dispersing this is to make sure that it's available as broadly as possible. On the bottom, you see here 3 antiviral medications, and I want to point out the one on the left, Veklury, is actually not something the state allocates or distributes. This was not purchased by the federal government. This is remdesivir generically. It has already been used for in hospital settings really since the beginning of this. It's really the only antiviral that is used directly for hospitalized patients, and now it has just been authorized for outpatient use. Unfortunately, for right now, only hospitals that have outpatient pharmacies and outpatient clinics are being allowed to order it, but the vision is eventually other outpatient settings can use remdesivir. However, that medication we don't direct or control. That's coming, the pharmacies or the health systems have to purchase this themselves, administer it to like they would any other licensed approved product, and get reimbursed through insurance, that type of thing. The 2 drugs on the right, the 2 antivirals there, they were purchased by the federal government, and we do work to allocate those, Paxlovid and Molnupiravir. Those 2 medications we are sending to pharmacies, and again, we make sure that pharmacies in every public health district, there's at least 1 pharmacy receiving these medications. Again, you can see as far as Paxlovid, which is the preferred agent, this is an oral medication, very effective against symptomatic COVID. Very good reductions in hospitalization have been seen with this medication. Molnupiravir is only kind of a second, if there's nothing else available, that is what is recommended in treatment guidelines. So we've distributed it. Unfortunately, that's what we have the most of. It's certainly effective, but not as effective as some of the other options. So you can see that clinicians have a lot to think about as they see patients and try to get them in for treatment. Our message to the public is, if you or your loved one is severely immune compromised, talk to your provider about getting Evusheld now before you get sick. If you have a friend or family member who has cancer, who has a severe immune compromised condition, they should be working with their provider, who should know how to access Evusheld. We have sent messages out to providers about this. If you get COVID, again, your provider should be able to get you either into a center for Sotrovimab or hopefully prescribe you one of the antiviral medications. We know it's not a perfect system yet. Our limiting factor is the amount of medication available in Idaho, available to us. We are ordering and using everything we can get, and encouraging providers to order anything they think they can use.